And joining me now to discuss today's abortion ruling is Dr. Deshawn Taylor. She's a board-certified OBGYN, clinical professor, women's health and reproductive rights advocate, and owner of Desert Star Institute for Family Planning in Phoenix. Dr. Taylor, first off, what is your reaction to today's ruling?
My reaction is one of, I'm not surprised. I was hopeful that we would not get this decision, but I was feeling a bit cynical about the possibility that the current composition of our Arizona Supreme Court would deliver a different decision today.
You know, part of this decision entails possible prosecution. Are you concerned about the repercussions that you could face along with other doctors in your situation? I mean, we could be talking about maybe perhaps 2 to 5 years in prison.
I'm very concerned about these criminal penalties. I became a physician because I wanted to take care of people, and providing abortion care is taking care of people. And I've dedicated my life and career to providing this care in a very compassionate and dignified way where people are seen, heard, and well cared for. And so the idea that I could be imprisoned for providing care, health care, is something that no doctor thinks about when they're going through the rigors of becoming a physician.
So what will you do?
At this point in time, we have to regroup and really understand what the decision means, and if there is a path forward to continuing to serve the people who have come to trust us with their care. Right now, abortion care is still available and legal through 15 weeks of pregnancy, and so those of us who are providing the services are still providing them. My understanding is that there's a limited amount of time that we have under this ruling, but I also was still seeing patients when the decision happened. I finished seeing patients before I came here, and so I have an opportunity to sit with the decision and talk to appropriate counsel to understand it better. Those are the next steps for me personally.
Right, but that window is closing. So moving forward, when this law is enacted, what are you going to tell your patients? What are your patients going to do?
Well, I will say just in real time, when we learned that the decision would come down today, the conversation had already changed about what to tell patients. We already had patients on the schedule, so we called people up to get them to the clinic sooner, not really understanding the nuances of how these things work, but making sure that we had people who had appointments today, so we wanted them to be able to get their care today. And then starting to have conversations about when people are calling in to make appointments, we are able to provide care now. We're still trying to figure things out. When we know more, you'll know more. But there are also still options for people to have abortion care outside of our state if that's necessary and people have the resources.
All right. Dr. Taylor, we appreciate your time. Of course, there's much more to talk about. We will have continuing coverage of today's abortion ruling, both on air and online. And as always, stay with 12news.com and the 12 News app for the latest updates.